Good day. My name is Chantal Edwards, and this afternoon I'll be presenting on Special Healthcare Needs, a literature review. Afternoon or objectives for today will take the following format. So we'll be looking at the description of the article that was assigned. We'll be looking at the major topic that is explored in the presentation. We'll be examining the type of article used. We'll be looking at the article's purpose. I'll be providing a summary of the article as well as giving an assessment of what I believe is the quality of the article assigned. So our first section is the article description. Most importantly, the title of the article is Medical, Nutritional, and Dental Considerations in Children with Low Birth Weight. And this gives us an idea of what we're about to explore and what we'll be focusing on throughout the presentation. Also of importance is the authoring of the article, and this was done by several female lecturers who specialize in pediatric endocrinology at the National Children's Hospital located in Dublin, Ireland, and they're listed below. Susan O'Connell, Anne O'Connell, Elaine O'Mullane, Hilary Hoy, and Hilary Hoy. Finally, the journal that the article was taken from, because we have to factor in publication, publicity, and validity, was the Pediatric Dentistry, and that is the abbreviated form of the journal. So it was published in December 2009, that particular issue, and it's volume 31. So now that we've gone through the basics of the journal itself, we know the title and we have an idea of where exactly in special needs we'll be focusing on, let us look at the journal impact factor. Now, journal impact factors are very important because it tells us just the degree of which an article is important, how common it is, how applicable it is to general society, and how much the average article is referenced in everyday life. Impact factors are used to measure basically the importance of the journal, and it calculates the amount of times the article itself is cited within the last few years. A high impact factor is indicative that the article is highly ranked and that the journal specifically is highly ranked. So in this case, the journal that was used was the Journal of Pediatric Dentistry, and we saw that it had an impact factor of 65. Now, the rule of thumb is that values above 10 tend to be on the higher side of impact factors. So with an index value of 65, it was deemed that the journal had a very high impact. Next, we look at the major topic of the presentation, special healthcare needs. And following this slide, we'll be looking at a diagram that basically sums up what the presenter herself understands special needs to be. Of special needs is the focus of individuals and families. We have to ensure that there is early continuous screening because one, for us to treat or implement any intervention, there has to be a detection and a diagnosis. So it is very important for special healthcare needs individuals and their families to be screened to either detect or diagnose or prevent future diseases from occurring or conditions from occurring. The transition to adulthood is also very important. Special healthcare individuals are sadly more so at risk to developing a poor quality of life in general. So promoting good healthcare, good independence, and good support amongst these individuals and families is integral from birth onwards. The families are always partners. It is important that they have a support system, and the support system around the family is always a factor in the quality and the outcome of life for these individuals. Insurance is important, and from a Jamaican context, it is woefully lacking in both the non-special healthcare needs population and the special healthcare needs population, but nonetheless, it is something that is very important. The access to a medical home is very important. It requires a continuous desire to learn, understand, to be compassionate and culturally aware about the scenarios surrounding the life of a special needs individual and also their family life. And finally, we recognize that community-based services that are provided through either government or non-governmental organizations are also very important, as well as access and availability to using them by all families. To the bulk of the presentation. The diagram on the right is showing a pyramid that basically explains how we classify articles. Now, at the top, the first three sections of the pyramid show that information can be filtered, and when it is more filtered, the quality of evidence increases. Contrary, the information at the lower four rungs of the pyramid are unfiltered, and as you descend the pyramid, the quality of evidence decreases. So why are we assessing this? The article that was given has to be classified, and based on the pyramid given and the assessment of the article, I deemed that my article belonged at the lowermost rung of the pyramid, as it provided background information and was mainly based on expert opinions. So as was aforementioned, the authors of the articles are members of the National Children's Hospital in Dublin, Ireland, and they all have some specialization in either pediatric endocrinology or just pediatrics in general, and that makes them authors on the issue of pediatric health and special needs pediatric health. However, as we go further, we'll see that the study or the article itself did not ascend the pyramid in terms of the study design, in terms of the information found. And so even though they are experts, the quality of the information has been deemed to belong at the bottom of the pyramid. So what can we say about expert opinions or background information as it relates to importance in assessing an article? Firstly, we have to note that the article will provide information, good information, summarized from other experts. So when the article is being assessed, it's always very important to look at the sources of the information given. So a quick perusal of the references from the article assigned showed that the research was extensive. It quoted many sources, some of which were actually more qualitative evidence of information, but it quoted at least 30 articles just to come up with a summative view for this article. Another feature of expert opinions or background information is that, as was aforementioned, the information is unfiltered. So even though it draws from many different sections, the collective or the summative article itself has a lower quality of evidence. Next, it has a longer time for publication. So on average, it's usually about 3 years for the article to be published. So in doing the research for this particular presentation, it was noted that it was published in 2009 issue of the Journal of Pediatric Dentistry, but no further information was given as to how long before publication the study was completed. Another feature again is that it includes information in other publications and published textbooks for examples, and that collates to the first point that was mentioned. Finally, it provides a convenient summary. So as opposed to an individual searching through all 30 articles that relate to a smidgen of the information that is of focus, this particular study would have summarized a huge chunk of it into a mere 9 pages. So it has its advantages and its disadvantages, but nonetheless, expert opinion still ranks on the lower rungs of quality evidence. Along in our presentation to find out what exactly was the purpose of this article. So remember that the article title speaks about medical, nutritional, and dental considerations in children with low birth weight. And we're focusing on an article in pediatric dentistry. So this is highly indicative of where we're going to go. But notwithstanding, let us look at a few points. According to the authors, and also just a paraphrasing, the article's purpose was to provide a comprehensive review to summarize the following points: the medical terminology and fetal growth-related issues surrounding special healthcare needs individuals, morbidity associated with low birth weight, morbidity associated with prematurity, morbidity associated with being small for gestational age, and the importance of appropriate nutrition in such infants. And just to point out that going forward, the abbreviations LBW will be used for low birth weight and SGA for small gestational age. So again, the articles themselves and a summary by the presenter herself found that the main purpose of this particular article was firstly to provide a review and secondly to summarize issues related to these 5 named points. Summarize the key points of the article. Going forward, we will see 13 key points that were extricated from the article, and I placed them in this format to show, one, the chronological ordering of the key points and also what I deem to be the importance of the article overall. So the first one was a classification of low birth weight. So the important thing about picking up an article and assessing it is that you have to know what you're talking about. And like I said, LBW is a term that's used throughout the article and in general, but what exactly does it mean? So with reference to the World Health Organization's glossary of terms, a low birth weight for an infant that is at term, meaning that they were born 37 to 42 weeks of gestation, means that they're below 5 pounds or 2.5 kilograms. And it's important to note that this definition excludes gender and precise gestational age. So if you say, but hold on, a boy baby usually weighs a little bit more than a girl baby, you're quite correct in thinking so. So again, the definition is not perfect, but just for a general estimation, if the child is within term, but still weighs less than 5 pounds or 2.5 kilograms, they will be deemed to have a low birth weight. SGA, the classification, means that the weight of the child is smaller than expected for its gender and gestation. So with reference to my previous example about boys versus girl children, you would expect a boy, for example, at term to be, for example, 5 pounds, but if he's born at 4 pounds, but also within the correct term, so about 38 weeks, 39 weeks, then you'd consider him small for his gestational age as well as being low birth weight. And then finally, we looked at the classification of prematurity. So that's any birth prior to term. And as was before mentioned, term refers to the 5-week period between 37 to 42 weeks of gestation. So these are all things that the author deemed important and the presenter herself deemed important to note as a means of understanding what exactly the article was trying to explain, as these are terms that are used repeatedly. And in assessing it, it was deemed that having the individual reader understand from the get-go what these definitions means posits the article as something that's easy to refer to gain an understanding. Important points highlighted that there were risk factors that played a role in low birth weight, small gestational age, and prematurity of infants. And the following points, they were expounded on, but in summation, we found that there was a role of maternal sociodemographics and ethnicity, and there was a role of smoking, which is unsurprising since smoking is a risk factor for so many pathologies. So we found that maternal demographics, for example, a Black mom was more likely to have a low birth weight child than an than a Caucasian woman, same age, same size, but just different socio-demographics. Conversely, it was found that foreign-born Asian Indian women who were of a high socio-economic standing tended to have low birth weight infants. So it wasn't conclusive in the article itself, and there was no information shown in the article, whether a value, an odds ratio, nothing like that to cement an idea that this was definitive. So again, that point was inconclusive. The role of smoking was also explored, particularly if there was any effect of carbon monoxide in decreasing the oxygen carrying capacity of the infant's blood, and that would have affected organogenesis, development in general. Risk factors that were explored included the effect of maternal periodontal disease, the role of maternal size, and the impact of maternal hypertension and preeclampsia. Now, maternal periodontal disease is something that the article itself pointed out required more research, as again it was inconclusive, and information with any association or correlation was only found in 2 of the sources that they referred to. And again, because there was no measurable value or any study or experiment undertaken, there was nothing conclusive to say that maternal periodontal disease definitively caused LPW or SGA. Notwithstanding, it was advised that the oral health of the mother be maintained prior to pregnancy and during pregnancy to limit any possible effect. Maternal size, again, the smaller the mom, it was determined that the chances of the baby being LBW or SGA were somewhat increased. The authors intended to focus on the morbidity associated with each of the 3 conditions listed. Now, the morbidity stemmed from the fact that there was just limited organogenesis for key organs such as lungs, intestines, and the brain. So the nervous system, the digestive system, and the respiratory system were integral organ systems that were severely underdeveloped in these conditions, and as such their functions could not be carried out, a lot of them being metabolic and respiratory, and that would have had an impact on just the overall growth rate of the infant. So it moves on to another factor of the article, which is how do we manage the nutrition of these infants. Paradoxically, a lot of these infants postnatal tend to become obese as an attempt from the parents to somewhat reverse what they deem to be the small nature of their children if they're not educated properly. So, based on the experts' opinion and what they found from previous articles, it was recommended that balanced meals were followed, regular upkeep with a nutritionist and a pediatrician were recommended so that the infant can receive proper dietary control instructions to the parents, macro and micronutrients, the degree of which they should be consumed, the frequency, etc. And to tie it all into what we're focused on, which is the oral health considerations, it was found that in some of these infants, they tended to have oral health issues, but again, with proper guidance from the family dental practitioner or establishing a dental home from early, then these are things that could be circumvented in special healthcare needs children who fall in the LBW, premature on postnatal obesity and body composition of the infant being something that was explored as well. Importantly, even though we've assessed that there's valuable information produced by the article, we have to ask ourselves, what exactly is it telling us? How good is it? Can we follow it? And for me to assess the article, I decided to focus on 3 evaluation criteria. I apologize for the sound. These are validity, reliability, and credibility. These are terms that we see pop up quite frequently as it relates to research, but To narrow it down, validity refers to basically the degree to which the measuring instrument captures the information correctly. So it can be internal or external. Does it capture it correctly from day one? And when I capture that information, can I apply it generally? Reliability refers to the degree to which the measuring instrument or tool can capture information and repeat and produce reproducible results, right? So I can do something twice and I'll get the same or very similar response. And credibility refers to the degree to which it is believed. Now, in general, a lot of the higher or the more filtered evidence examples, they normally have evaluation criteria to assess them with specific questions. Is this provided? Is the odds ratio this? Is the standard deviation? What are the confidence intervals? That sort of information. But because of the article type, it being an expert opinion piece, there is little to no measuring data to use. So there weren't any variables presented. There wasn't anything to be measured per se. There wasn't an instrument to collect information. There was no study design, and all of these things were factored in answering all of these things. So I said that it was valid, yes, to an extent, as it relates to the external validity of the article, because it was generalizable. Firstly, by virtue of the impact factor. So the fact that it's referred to so many times suggests that researchers or just individuals in general who are trying to find information have found some link between what was presented and what they're experiencing in daily life or practice. However, that yes becomes besmirched by a no because there was no internal validity. So as was before mentioned, there was no described tool or measurement or study design to say how am I exactly coming to a conclusion about this information. So because of that, it's a yes for external validity somewhat, but no for internal validity. Furthermore, I decided that the article was not reliable because it was not an experiment that was conducted. It was not quantitative research. It was not something that was done once and then concluded, let alone to be done twice or thrice with similar reproducible results. And with those two things in mind, I deemed the article as being not credible. Not credible because it has limited validity and it's not reliable. I cannot conclusively say that if I have a low birth weight patient, then these are things that I have to go by because there is no conclusive evidence from this particular article. So if I were to deem it credible, I would suggest that a study design be created, a tool of measurement be utilized, so interviews, running a cohort study, for example, or even a case control study would have been a better example to make these conclusions, and that would have rendered the article credible. So again, I deemed it externally valid to an extent, but not internally valid, not reliable, and not credible in my overall assessment of this article. Here are a few images as part of our appendix, so a table that provided a summative definition of low birth weight, extremely low birth weight, small for gestational age, large for gestational age, preterm, and term. So these were things that came out in the presentation, and this is just in tabular form. And then table 2 tells us the maternal risk factors which were mentioned. So socioeconomic factors, ethnicity, smoking, maternal periodontal disease, and the list continues. But again, these were just risk factors. They weren't definitive correlations because there was just no evidence. For a pictorial representation of what we mean by low birth weight, you can look to the left of the screen where we see a baby weighing 1.1 pounds, which, as I mentioned, when you're less than 5 pounds, low birth weight. To our right, we have a premature infant, and at the bottom of the screen, we have a child that's small for its gestational age. That concludes my presentation with a reminder that we are all wonderfully made, whether some of us have a little bit more special needs than others, but notwithstanding, we are all capable, we're all wonderful and unique in our own right. So credit is given to PowerPoint for providing a template, and the editing and presentation were done by myself, and our email address is written below if there are any further concerns and just in general for the feedback. Thank you.